Welcome to our presentation on mood stabilizers. Mood stabilizing agents are commonly used to treat disorders such as bipolar disorder by reducing the occurrence and intensity of mood episodes such as manic episodes and/or episodes of depression. They are also used to treat mood swings and episodes in disorders such as schizophrenia, major depressive disorder, and panic disorder. This is a list of mood stabilizers that are commonly prescribed. The focus of our presentation will be on lithium, divalproex sodium, carbamazepine, and lamotrigine. Lithium is classified as an antimanic. It alters the cation transport and exchange in muscles and nerves. Lithium may influence or control the reuptake of neurotransmitters. It is used to prevent or decrease acute manic episodes of bipolar I disorder. It is used for the treatment, maintenance, and prophylaxis of bipolar I disorder. Contraindications for lithium include hypersensitivity and severe cardiovascular or renal disease. It should only be used where blood lithium levels can be closely monitored. Patients should use caution during lactation and also when using with any degree of renal, cardiovascular, thyroid disease, and diabetes mellitus. Lithium toxicity can occur at levels close to therapeutic values. Make sure resources are available to treat lithium toxicity. Some side effects for lithium include fatigue, headache, impaired memory, ECG changes, abdominal pain, anorexia, bloating, diarrhea, nausea, polyuria, and hypothyroidism. This is the time action profile for lithium. This is the time action profile for lithium. Lithium may prolong the action of neuromuscular blocking agents. It may increase the risk of neurologic toxicity with haloperidol. Diuretics, methyl-dopa, probenecide, fluoxetine, and NSAIDs may increase risk of toxicity. Blood levels may be increased by ACE inhibitors. Lithium may decrease effects of chlorpromazine. Chlorpromazine may mask early signs of lithium toxicity. Hypothyroid effects may be additive with potassium iodide or antithyroid agents. Aminophylline, phenothiazines, and drugs containing large amounts of sodium may increase renal elimination and decrease effectiveness. Psyllium can decrease lithium levels. Assess mental status and orientation when taking lithium. Monitor intake and output ratios. Monitor weight periodically. Monitor serum lithium levels twice a week when initiating therapy and immediately before morning doses. Assess the patient for signs and symptoms of lithium toxicity. The patient should take medication as directed even if patient status has improved. Avoid driving until side effects for patient are known. Drink at least 2,000 to 3,000 milliliters of fluids per day and maintain a diet with moderate sodium intake to prevent low sodium levels and toxicity. Avoid diuretic beverages such as coffee and tea. Notify healthcare provider if any toxicity side effects occur and stop the medication. Advise patient to use contraception or tell healthcare provider if pregnancy is planned due to possible teratogenic effects. Consult with healthcare provider before taking any other medications, especially NSAIDs. Divalproex sodium is classified as an anticonvulsant and vascular headache suppressant. Divalproex sodium increases levels of GABA, an inhibitory neurotransmitter in the CNS. It is used for suppression of seizure activity, decreased manic episodes, and decreased frequency of migraine headaches. Is contraindicated in hypersensitivity and hepatic impairment. It is also contraindicated in known or suspected urea cycle disorders, as well as mitochondrial disorders, and should be used with caution with bleeding disorders, history of liver disease, renal impairment, and lactation. Hepatic failure resulting in death occurred in patients receiving Depakon. Children under 2 are at a considerably increased risk for hepatotoxicity. Valproate has teratogenic effects that may cause neural tube defects. Life-threatening pancreatitis has occurred in children and adults taking valproate. Some side effects of valproate are dizziness, headache, insomnia, sedation, visual disturbances, abdominal pain, anorexia, diarrhea, indigestion, nausea, vomiting, and tremors. Valproate may increase the risk of bleeding with warfarin. Blood levels and toxicity may be increased by aspirin, carbamazepine, chlorpromazine, cimetidine, erythromycin, or felbamate. Increase in CNS depression with other CNS depressants. MAO inhibitors and other antidepressants may decrease seizure threshold and decrease the effectiveness of valproate. Carbamazepine, meropenem, phenobarbital, phentoin, or rifampin may decrease valproate blood levels. Valproate may increase toxicity of other medications. Concurrent use with topiramate may increase risk of hypothermia and hyperammonemia with or without encephalopathy. Assess location, duration, and characteristics of seizure activity. Institute seizure precautions for patients. When using with bipolar disorder, assess mood, ideation, and behavior frequently. Monitor frequency and intensity of migraine headaches. Assess for suicidal tendencies, especially during early therapy. Restrict amount of drug available to patient. Monitor for signs and symptoms of pancreatitis. Advise the patient to take medication as directed. Advise the patient to avoid driving or other activities that require alertness until side effects are known. Notify a healthcare provider of all medications and consult before taking any new medications. Advise the patient to avoid alcohol while taking medication. Advise patient and family to alert healthcare provider if any suicidal thoughts or actions occur. Advise the patient to notify healthcare professional if any adverse reactions occur. Instruct female patients to notify healthcare professionals immediately if pregnancy is planned or suspected or if breastfeeding.
Our next drug is carbamazepine, also known as Tegretol. Its classification is an anticonvulsant. It decreases synaptic transmission in the CNS by affecting sodium channels and neurons. Its therapeutic uses are prevention of seizures, relief of pain, and decreased mania. Some contraindications and precautions are hypersensitivity with MIOIs and history of bone marrow depression. Caution should be used when lactating. It may increase risk of suicidal thoughts and behaviors, and it should be used cautiously in cases of cardiac, liver, renal disease, in the elderly, during pregnancy, and with bleeding disorders or bone marrow depression. Some side effects for this drug are drowsiness, ataxia, nausea, vomiting, and blood dyscrasias. The effects of carbamazepine are increased and decreased by the following drugs. Some nursing considerations are monitor closely for changes in behavior that can indicate the emergence or worsening of suicidal thoughts or behavior or depression. Monitor for changes in skin condition in early therapy. Serum blood levels should be routinely monitored during therapy. You should instruct the patient to take carbamazepine around the clock as directed. Take missed doses as soon as possible, but not just before next dose. Do not double doses. Advise patient to avoid grapefruit and grapefruit juice during therapy. Advise the patient not to take alcohol or other CNS depressants concurrently with this medication. Caution patients to use sunscreen and protective clothing clothing to prevent photosensitivity reactions. Our last drug is lamotrigine, also known as Lamictal. Its classification is an anticonvulsant. It stabilizes neuronal membranes by inhibiting sodium transport. Its therapeutic uses include decreasing incidence of seizures and delays time of recurrence of mood episodes that occur in patients with bipolar disorder. Some contraindications include hypersensitivity and for acute manic episodes. Should be used cautiously in patients with impaired cardiac function, hepatic function, and renal function. Patients may have increased risk of suicidal thoughts and/or behaviors. Some side effects for this drug are suicidal thoughts, dizziness, headache, behavioral changes, depression, drowsiness, insomnia, tremor, blurred vision, nausea, and vomiting. Use with carbamazepine may increase levels of an active metabolism. Dosage adjustments may be needed when stopped or starting a new oral contraceptive. Use with drugs that inhibit glucuronidation may increase the frequency of rash. Some nursing considerations for this drug are monitor behavioral changes that could indicate an increase in suicidal thoughts or behaviors or worsening of depression. Assess skin for rash. Discontinue the drug at first sign of a rash. Stevens-Johnson syndrome may occur and is life-threatening. Monitor patient for signs and symptoms of hypersensitivity reactions, especially with the organs. You should educate the patient to take medication as prescribed and why this is necessary. Teach the patient to notify the healthcare provider immediately if increase in seizures, rash, fever, or swollen lymph nodes occurs. Do not drive or perform any dangerous activities until cleared by healthcare provider, as drug may cause drowsiness and blurred vision. Advise the patient and the family to immediately notify healthcare provider if increased thoughts of suicidal thoughts or actions occur. Female patients should be educated to use a non-hormonal form of contraception. These are our references for our presentation.